On October 8th, Dozee launched its groundbreaking health monitoring device, Shravan, in Bangalore, designed specifically for non-resident Indians concerned about the health of their elderly parents living in India. Shravan, a contactless AI-powered device, can monitor vital signs such as heart rate, respiration, and sleep patterns from under a 29-inch thick mattress without the need for wearables. Notable figures at the event included Mudit Dandavate, CEO of Dozee, and Indian-American entrepreneur Sid Panigrahi, who will distribute Shravan through his US-based company, Meriglobo. Shravan allows NRIs to remotely track their parents' health in real time via an app offering peace of mind and early detection of health issues. The device is expected to be a valuable tool for the millions of NRIs living abroad with aging parents in India.
Apollo, world's largest integrated healthcare provider, is setting new standards in patient safety by achieving zero-code blues record through their enhanced connected care program.
So the enhanced connected care program is actually a paradigm shift in the way the healthcare will be provided in the future. The reason why we thought about this program was because we know that the critically ill patients, and we know this from our COVID experience, they don't just confine themselves to the critical care units in the hospitals. You can find them at home, you can find them in the ambulances, you can find them in emergency rooms, and you can find them in the normal wards in the hospitals. Wouldn't it be nice if we could capture them before they really became critically ill? And that's the vision of this program. Pan Apollo, we are going to be monitoring our patients 24/7, round the clock.
With that objective and intent, we are looking for all technologies available in the world, and we come across with enhanced care, which has brought down the codes significantly, almost about in the last 200 days. I have a zero code blues, which is significant. When we take the patient on board, we'll connect the devices and we'll set the baselines and we record those things. And those vitals, whether it is heart rate, blood pressure, saturation, respiratory rate, and all those things are lively monitored in the nursing station.
If we didn't have these sensor sheets under the bed coverings, or if we didn't have the patches that go on patients' chests, if we didn't have the technology to transmit that data into the cloud and then capture it on nursing stations and in the command centers, if we didn't have this kind of connectivity, which is what technology has provided us, we wouldn't be nowhere, we wouldn't be able to start. We'd still be doing what we have been doing.
This device actually helped each nurses to save their 1 hour of time in each shift. So that has enhanced the patient care and patient satisfaction and the safety of the patient.
When patients participate in their care delivery process, they know what's happening. When we apply all these devices and patients able to see what is their heart rate, what is their blood pressure, and they also know they're continuously monitored. When they're continuously monitored, naturally they know someone is looking and monitoring me, and also with their involvement, their confidence and their satisfaction level always keep increasing.
We are covering now at least 15 to 17 hospitals out of our 70 hospitals. We only started 6 months ago, and the plan is to cover at least 40 hospitals by the end of this year. Now that technology gives us the chance of making safe care even safer, why not?
It's been 5 years since my father passed on. And the only regret I've had in life so far is that I haven't been able to spend time with him. I thought I'd do that with my mom, but she didn't want to change things and prefer living alone. So I was always looking for a way to ensure that my mother is okay. And Dozee helped me achieve that. There is no stopping my mom when she sets her mind to do something. She'll do everything without thinking how working so much will affect her health later. So that's why I got her Dozee, so I could keep track of all her vitals without disturbing her. With the updates I was getting from Dozee, I knew everything was fine with my mom. But one day, I got an alert. When I asked her, she dismissed it. She said maybe I was just working a bit too much. But I couldn't ignore it. So I spoke to my doctor and he said we could run some tests on her. Thank God we did the tests. The reports revealed that she had some abnormal heart rhythm and she required a pacemaker to set it right. The doctor said we were lucky to catch this so early because even a minor delay in that situation would have been catastrophic. And Dozee gave me what I wanted most: more time with my mother. I sleep peacefully now, knowing fully well my loved ones are always safe with Dozee.